am Dr. Udas Ghosh, Professor, Department of Medicine and Rheumatology Unit, Medical College, Kolkata. Today I have a talk. My topic was COVID-19 infection, hypercoagulability and antiphospholipid syndrome. You know that COVID infection, what we have faced, we have already faced the third phase. Particularly in the second phase, we have lost many people, and the main involvement is the lung. COVID is also affected other organs also. The development of ARDS in the COVID due to the microthrombus formation, and that is most important in the pathophysiological mechanism. So, why the hypercoagulability state is there? So, if you discuss about the formation of any thrombus, three things is required. One is a stasis of the blood, two is a endothelial dysfunction, and three is the the other, particularly injuries and others. So, stasis of the blood and also the endothelial injuries and hypercoagulable state that causes the microthrombus formation in the different vessels, including the pulmonary vessels, and that is why in a severe COVID near about 30 to 54% patient develop microthrombosis or different thrombus formation in other organs. So, lung is the main major organ involved, and heart, brain is also, kidney is also involved. So, why this type of hypercoagulable state is there? So, this is due to different formation of different cytokines. This is a pro-inflammatory states. This is a TNF alpha, interleukin 1, 6 and 8 that causing this endothelitis, that is also producing endothelial dysfunction and resulting the disease type of microvascular thrombosis formation. So, not only that, we also seen that there is a increased fibrinogen, increased D-dimer, and also in many cases we see that there is also increased APTT. So, increased APTT is seen many of the patient, and in those patients we can see there is a antiphospholipid antibodies are also present. We know there is a 3 antiphospholipid antibody. One is a anticardiolipin antibody and beta 1, beta 2 microglobulin and lupus anticoagulant. And here in COVID infection, in a severe COVID infection, anticardiolipin antibody is positive. Usually they become positive, and also beta 2 microglobulin also positive, and lupus anticoagulant are positive, but the lupus anticoagulant and anticardiolipin antibody are more positive than beta 2 microglobulin, and this positivity does not produces antiphospholipid syndrome, because it differs from the primary antiphospholipid syndrome disease. So, in such patients of COVID infection, so though we have to check for the antiphospholipid antibodies, but these antibodies usually vanishes or disappears after 4 to 6 weeks. But what is the fate if these antibodies are present in antibodies are present in a COVID infection? There is a much more chance of development of thrombosis. Even if a patient of antiphospholipid syndrome patient develops COVID infection, patient may develop catastrophic antiphospholipid syndrome. So, that is why we have to treat accordingly those patients having increased APTT, increased D-dimer and increased CRP, increased fibrinogen, treat confidently with anticoagulant, even antithrombotic agent. So, we have to give oral anticoagulant, even newer anticoagulant, till the D-dimer value, CRP value reduces. Otherwise, a patient may develop other thrombotic events, and that is all what we have said in this our topic. Thank you for listening.